Hello, good day to you. Today, we'll be discussing an essential aspect of nursing practice, safe medication administration. Ensuring patient safety is our top priority, and this includes correctly administering medications. We'll be covering the 6 rights of medication administration. By the end of this session, you will be able to identify the 6 rights of medication administration, understand the significance of each right in ensuring safe and accurate medication administration, explain the importance of verifying the patient's identity and the medication details before administering any medication. Demonstrate knowledge of the appropriate procedures for administering medication via different routes. Recognize the role of accurate documentation in medication administration and its impact on patient safety and continuity of care. Apply the principles of the 6 rights in a practical scenario to assess their ability to make safe and informed decisions during medication administration. Let's start with the basics. The 6 rights of medication administration are crucial to avoid errors and prevent harm to patients. They are: first one, right patient; second one, right drug; third one, right dose; fourth one, right route; fifth one, right time; sixth one, right documentation. We'll go each of these rights one by one. First one, right patient. Always ensure you are administering medication to the correct patient. Use at least 2 patient identifiers such as their name and date of birth to confirm their identity. Remember, errors can happen, but we must do everything in our power to prevent them. Second one, right drug. Verify the medication name and compare it with the order or prescription. Pay attention to look alike and sounds alike medications that can easily be confused. When in doubt, consult with a colleague or a pharmacist. Third one, right dose. Check the prescribed dose and make sure it is appropriate for patient's age, weight, and condition. Use the metric system whenever possible to avoid errors in conversions. Fourth one, right route. Administer medication using the prescribed route. Routes are oral, intravenous, intramuscular, etc. Some drugs are specific to certain routes, and giving them via the wrong route can be harmful. Fifth one, right time. Administer medications at the scheduled time as indicated in the prescription or healthcare provider's order, avoiding skipping doses or giving them too close together. Sixth one, right documentation. Accurate and timely documentation is vital. Record the medication administration promptly and include relevant details such as the time, date, route, and any specific instruction given to the patient. To reinforce these principles, let's go through a scenario together. Think, you have a medication to administer to a patient. What steps will you take to ensure safe medication administration? Take a moment to think about it. Great. Let's walk through the steps. First, identify the patient using at least two identifiers, such as their name and date of birth. Then, verify the medication name and dosage, comparing it with the prescription. Third, confirm the appropriate route for medication administration. Then, check the administration time and ensure it aligns with the prescribed schedule. Then, administer the medication following the correct procedure for the chosen route. Lastly, document the administration promptly and accurately, including any patient response or important information. Okay, look at the following simple questions. Try to provide answers for them. Question number 1. What are the 6 rights of medication administration? Question number 2. Why is it essential to verify the patient's identity before administering medication? Third one. What should you do if you encounter a medication name that sounds similar to another drug in your facility? Fourth one, why is accurate documentation important in medication administration? Last one, what should you do? What should you consider when administering medication via the intramuscular route? Okay, let's see what are the answers. Question number 1. What are the 6 rights of medication administration? Those are right patient, right drug, right dose, right route, right time, right documentation. Question number 2. Why is it essential to verify the patient's identity before administering medication? Verifying the patient's identity is crucial to encounter that the medication is given to the correct person. Using at least 2 patient identifiers, such as their name and date of birth, to prevent medication errors and enhances patient safety. Question number 3. What should you do if you encounter a medication name that sounds similar to another drug in your facility? If you encounter a medication name that sounds similar to another drug in your facility, exercise caution and double check the medication's name and dosage with the prescription. If you have any doubts or concerns, consult a colleague or a pharmacist for clarification. Question number 4. Why is accurate documentation important in medication administration? Accurate documentation is vital in medication administration because it provides a clear record of the medication given, the dosage, the route, and the time of administration. Proper documentation helps healthcare professionals track a patient's medication history, monitor treatment effectiveness, and avoid potential errors or adverse reactions. What should you consider when administering medication via the intramuscular route? The last question. When administering medication via the intramuscular route, consider the appropriate site for injection, the patient's muscle mass, and the recommended needle length and gauge. Rotate injection sites to prevent tissue damage and monitor for any signs of adverse reaction and administration after administration. Thank you.